The vagina, a remarkable part of the female reproductive system, possesses a delicate ecosystem. Maintaining its health is crucial for overall well-being. A healthy vagina has a slightly acidic pH, protecting against harmful bacteria. This balance is maintained by lactobacilli, producing lactic acid. Understanding this environment helps manage and prevent infections. Infections occur when this balance is disrupted. Most infections are easily treatable. Yeast infections, or candidiasis, are caused by an overgrowth of Candida albicans. This overgrowth can occur due to antibiotic use, hormonal changes, and weakened immune systems. Yeast infections affect nearly 75% of women. Symptoms include thick white discharge, intense itching, and burning. Pain during urination and sexual intercourse is also common. Consult a healthcare professional for an accurate diagnosis. Preventing yeast infections involves good hygiene and wearing breathable cotton underwear. Bacterial vaginosis, or BV, results from an imbalance in the vaginal flora. An overgrowth of anaerobic bacteria disrupts the vaginal ecosystem. Symptoms include a thin, grayish-white discharge with a fishy odor. Diagnosis involves a pelvic exam and analysis of vaginal discharge. Treatment usually involves antibiotics, either orally or as a vaginal cream or gel. Trichomoniasis, often referred to as trich, is a sexually transmitted infection caused by the parasite Trichomonas vaginalis. It's one of the most common curable STIs worldwide. Trichomoniasis can affect both men and women, but women are more likely to experience symptoms. Symptoms of trichomoniasis in women can range from mild to severe. Some women may not experience any symptoms at all. Common symptoms include a frothy, greenish-yellow or gray vaginal discharge with a foul odor. Itching, burning, redness, and swelling of the vulva are also common. Pain during urination and sexual intercourse can also occur. Diagnosis of trichomoniasis involves laboratory testing of a vaginal swab or urine sample. Early diagnosis and treatment are important to prevent complications and transmission to sexual partners. Untreated trichomoniasis can increase the risk of other STIs, including HIV. Treatment for trichomoniasis typically involves a single dose of oral antibiotics, such as metronidazole or tinidazole. It's crucial that all sexual partners are treated simultaneously to prevent reinfection. Abstaining from sexual activity until treatment is complete is also recommended. Recognizing the symptoms. Recognizing symptoms is crucial for early diagnosis and treatment. Symptoms can overlap, making self-diagnosis challenging. Seek professional advice for accurate assessment. Yeast infections often manifest with thick white discharge. Bacterial vaginosis presents with a thin, grayish-white discharge. Trichomoniasis can cause frothy, greenish-yellow discharge. Section 6. Preventing vaginal infections. Practical tips. Preventing vaginal infections involves adopting healthy lifestyle choices and hygiene practices. By understanding the factors that contribute to infections, you can take proactive steps to maintain a healthy vaginal environment. Simple changes can significantly reduce your risk. Maintaining good hygiene is paramount. Wiping from front to back after using the toilet helps prevent the spread of bacteria from the rectum to the vagina. Avoiding douching is also crucial, as it disrupts the natural balance of the vaginal flora. Douching can actually increase the risk of infections. Choosing breathable underwear, preferably made of cotton, is essential. Cotton allows for better air circulation, preventing excessive moisture buildup, which can create a breeding ground for harmful microorganisms. Avoiding tight-fitting clothing, especially during exercise, can also help prevent infections. Practicing safe sex is crucial for preventing sexually transmitted infections like trichomoniasis. Using condoms consistently and correctly can significantly reduce your risk. Limiting the number of sexual partners also minimizes the chances of exposure to STIs. Section 7. Over-the-counter treatments, relief at your fingertips. Over-the-counter, or OTC, treatments are readily available for some vaginal infections, particularly yeast infections. These treatments offer convenient and accessible relief from common symptoms. However, it's important to use them judiciously and seek professional advice if symptoms persist. Antifungal creams and suppositories are the most common OTC treatments for yeast infections. These medications contain active ingredients like meconazole or clotrimazole, which effectively combat the overgrowth of Candida albicans. They are available in various formulations and durations of treatment. While OTC treatments can be effective, it's essential to ensure you are treating the correct condition. Self-treating based on assumptions can be risky and may delay appropriate treatment for other infections. If symptoms don't improve after using OTC medications, consult a healthcare professional. It's also important to follow the instructions provided with OTC treatments carefully. Using them incorrectly or for longer than recommended can lead to complications or reduce their effectiveness. If you have any doubts or concerns, consult a pharmacist or healthcare provider. Section 8. Prescription medications, when professional help is needed. While over-the-counter treatments can be effective for some vaginal infections, others require prescription medications. Bacterial vaginosis and trichomoniasis, for instance, necessitate antibiotics prescribed by a healthcare professional. Seeking professional care ensures accurate diagnosis and appropriate treatment. Antibiotics such as metronidazole or clindamycin are commonly prescribed for bacterial vaginosis. These medications can be administered orally or as a vaginal cream or gel. The specific antibiotic and duration of treatment will depend on the individual case and the severity of the infection. Trichomoniasis is typically treated with a single dose of oral antibiotics, such as metronidazole or tinidazole. It's essential that all sexual partners are treated simultaneously to prevent reinfection. Abstaining from sexual activity until treatment is complete is also recommended. Prescription medications offer targeted treatment for specific infections. They are more potent than over-the-counter options and are necessary for effectively eradicating certain microorganisms. Following the prescribed dosage and completing the entire course of treatment are crucial for optimal outcomes. Section 9. Seeking professional care. Your path to accurate diagnosis. Seeking professional care is essential for accurate diagnosis and personalized treatment of vaginal infections. Healthcare providers have the expertise to differentiate between various infections and determine the most appropriate course of action. Self-treating can be risky and may delay appropriate care. During a consultation, your healthcare provider will likely ask about your symptoms, medical history, and sexual activity. They may perform a pelvic exam to visually assess the vagina and vulva. They may also collect a sample of vaginal discharge for laboratory testing. Laboratory tests can identify the specific microorganism causing the infection. This helps determine the most effective treatment strategy. For instance, a wet mount examination can identify yeast infections and trichomoniasis, while a vaginal pH test can indicate bacterial vaginosis. Seeking professional care not only ensures accurate diagnosis and treatment, but also provides an opportunity to address any underlying health conditions that may be contributing to recurrent infections. Regular gynecological checkups are essential for maintaining optimal vaginal health. Section 10. Maintaining long-term vaginal health. Maintaining long-term vaginal health involves adopting a holistic approach that encompasses lifestyle choices, hygiene practices, and regular checkups. By prioritizing vaginal health, you can prevent infections and promote overall well-being. Small changes can make a big difference. Maintaining a healthy diet and staying hydrated are crucial for overall health, including vaginal health. A balanced diet provides the nutrients necessary for a strong immune system, which plays a vital role in preventing infections. Staying hydrated also helps maintain the natural moisture balance of the vagina. Managing stress effectively is also important. Stress can weaken the immune system, making you more susceptible to infections. Incorporating stress-reducing activities such as exercise, yoga, or meditation can benefit your overall health, including vaginal health. Regular gynecological checkups are essential for early detection and prevention of vaginal infections and other gynecological conditions. These checkups provide an opportunity to discuss any concerns with your healthcare provider and receive personalized advice on maintaining optimal vaginal health. Section 11. Conclusion. Empowering your vaginal well-being. Vaginal health is an integral part of overall well-being. Understanding the delicate ecosystem of the vagina, recognizing the symptoms of common infections, and adopting preventive measures are crucial for maintaining optimal vaginal health. Empowering yourself with knowledge is the first step towards proactive care. This guide has provided a comprehensive overview of common vaginal infections, including yeast infections, bacterial vaginosis, and trichomoniasis. We have explored their causes, symptoms, prevention strategies, and treatment options. By familiarizing yourself with this information, you can take charge of your vaginal health. Remember, seeking professional care is always the best approach for accurate diagnosis and personalized treatment. Self-treating based on assumptions can be risky and may delay appropriate care. Regular gynecological checkups are essential for early detection and prevention of infections. By prioritizing vaginal health, practicing good hygiene, seeking professional care when needed, and adopting a healthy lifestyle, you can maintain a healthy and balanced vaginal environment, empower yourself with knowledge, and take proactive steps towards optimal vaginal well-being.